Hi, are you a doctor? Can you tell me about my daughter's symptom? She's been sick for a while, and I'm so much worried about her graduation in May.
I'm not a doctor, I'm a nurse. I'm Jennifer. I'll be looking after Lindsay today. Are you Lindsay's mom?
Yes, I
Yeah?
am. Nice to
Okay,
meet you.
Nice to meet you too. Lindsay?
Hi.
Hi, how are you feeling today?
I'm really tired. I've been so exhausted lately. I missed my soccer tournament this weekend, and I have this terrible rash on my face and on my body, and I'm worried if it'll ever go away. I can't see my friends like this. I have grad coming up. I'm stressed that I might not be able to go, and I've been so tired I don't even know if I'll get through my dinner, never mind my dance with all my friends.
So the disease that Lindsay's been diagnosed with is lupus. Can you tell me what you know about that?
Oh, well, when I brought her to the family doctor, she was tired, she has rash on her body, she haven't eaten well, haven't performed well on the sports. So doctor took a test, and he said lupus something, and also mentioned about the immune problem, but I honestly don't know what it is, so feel bad.
Okay, so that's okay, that's why we're here. Lupus is a lifelong chronic illness, and to this date we don't have a cure.
Oh no.
It is a disease that suppresses your immune system and causes it to attack itself, but it can be managed in different ways by creating a plan to kind of minimize the effects. Lindsay, can you tell me what you know about this, understand about this so far?
What I'm understanding is you're saying it's never going to go away, but we might be able to manage some of my symptoms or the disease so that I'm not in the hospital for the rest of my life, and maybe this rash can go away.
That's right. So we're going to first go over some common signs of triggers. So if you're experiencing any pain, fever, illness, injury, change in medication, those are all common triggers that can induce a flare-up of your symptoms. Okay, and you need to contact your primary care provider if any of those happen or they're worse or anything new comes up.
How do I keep the rash from happening? How do we stop that?
So the rash is likely due to sun exposure, which is a trigger. So I would limit the amount of time you're spending outside with your sports. If you are out, make sure you're covering up, wearing lots of sunscreen, a hat, to minimize the exposure to your skin with sun.
And I've been really tired lately. I'm worried about making it through grad. How do we plan for that?
So part of a symptom of lupus is the fatigue, and you need to really try to make a plan about how you're going to spend that day. Try to get things done ahead of time, pictures, nails, that sort of thing. Get that done the day before, and then the day of, make a plan so that you get a lot of time to rest, maybe between the ceremony and dinner, so that it's not too stressful, because stress is also a trigger. Make sure you talk about it with your friends and family so you're not carrying all the load on your own. Okay. Is there anything you can tell me about what we've learned and spoke about today?
Well, it is important for me to go to grad, so I'm hearing that if I rest and I do some of my planning ahead of time, I might have the energy to make it through grad with my friends. And I'm also hearing that if I spend less time in the sun, wear sunscreen and a hat, I might be able to keep the rash from coming on my face.
Yeah, that sounds good. Mom, can you tell me a couple things that you've heard today or understand?
Sure. I'll support her to manage symptoms and help her to make a plan ahead of the event. Also, I'm going to buy more sunscreen to use.
Yeah, that sounds wonderful. Okay, so can you tell me when you're going to contact your primary caregiver?
Oh, okay. When she has symptoms which is bad or new, then I'm going to contact my family doctor. Then maybe today after I leave here, I'll call them to make an appointment for follow-up.
Yes, make sure you do call today.
Okay,
to get
I
your
will.
follow-up
Yes.
appointment. Okay, excellent. So I have a pamphlet here that'll give you a little bit of additional information,
Oh, yeah?
some YouTube videos that I've looked over that I feel would apply to Lindsay's situation.
Okay.
And yeah, you can just have a look over, and then I'll be around today if you have any additional questions.
Okay, I'll take a look. Thank you.
Okay, thank you. It's been great to meet you guys, and I think you're so brave to handle all of this. It's not an easy change in life, but I think you'll do great.
Thank you.
Good.
Thank you.